Hey guys, welcome listeners. Welcome back to another episode of Health Tea with Dr. B, the MP. That is me. We are officially on episode 17, Sunshine and Serenity, Nurturing Your Mental Garden. I apologize for missing Health Tea with Dr. B 2 weeks ago. I was unfortunately hacked. Facebook, Instagram, and YouTube. So yeah, I couldn't go live on any of those platforms for a while. I was placed on timeout. Don't know exactly why. I just hope that I continue to be able to do these podcasts, or else I have to go to another platform and spread and share my voice that way. But I wanted to share this post in May for mental health because today we're going to be discussing mental health. But I thought it was appropriate to do it today because mental health isn't just discussed for 1 month at a time. All right. Mental health should be an ongoing conversation no matter what. So that is what we're going to discuss. I also wanted to shed light on even my mental health over the past 2 months, right? So everyone always assumes that the provider is doing well because they're taking care of patients. They should know how to take care of their mental health, right? That is the assumption. And of course, that should be the thing, right? But most importantly, over the past few months, I've dealt with unexpected patient deaths and unexpected patient conversations. So let's go into the deaths. I had a few patients die. Some were older adult, and the one who recently passed was a younger adult, 25 years old, who passed from cancer. Patient was diagnosed with cancer, let's say in December, January of this year. And April 1st, she was told that she was cancer free. And by May 1st, her cancer had come back and it spread. And then a few weeks later, she was gone. So that took a toll on me mentally, just because of how young and beautiful she was. And she didn't, in my head, she didn't really get to see what life truly had to offer. But the comfort that I've gotten was knowing that she really did live her life to the fullest, which is what we really have to be mindful about. Life is so short. Please do not stress about the little things. Just live your life, right? Live your life like nobody's watching. Live your life, right? And then I also had a couple of different unexpected patient interactions and conversations. So we all know that Health Tea with Dr. B and my practice, True Phoenix Community Care, was built on a certain type of foundation. And that foundation is making sure that patients always feel like they're being heard, that they're seen and fairly treated with quality of care, of course, right? But most importantly, I pride myself in my practice on making sure that patients are able to be educated and advocate for themselves, right? Well, I found myself in a sticky situation where not a lot, where a few patients decided to use their advocacy on me. And I'm only chuckling because it's not a laughing matter, but I'm only chuckling because I really do try to make sure that you guys know what's out there. And I'm so honest. When you guys come to my practice to be treated, I am a functional medicine provider. I practice functional primary care, which is different, right? Once we start a plan of care, once we start a plan of care as one of my patients, right? Anytime that there are other doctors or other specialists involved, I typically bow out because now it doesn't mix. The only time it mixes is when you have a functional specialist, functional medicine specialist, and a functional primary care. And in our area, that is not heard of or seen. It's not even really respected because of functional medicine and people's views on it. So typically, when I start a treatment plan, that is for you, and we can't have too many hands in the pot. We can't because it confuses you as the patient and it confuses everything. And unfortunately, what will happen is it'll result in the breakdown of care and treatment plan. So I'll always advocate. I say, hey, choose which route you want to go. I am supportive and with you no matter what. If you come into my office and you're diagnosed with Hashimoto's and things of that nature, and you want to see a specialist, Absolutely. However, I cannot undermine what that specialist says. However, if you want to stick with me because I'm treating it, then we can't have another specialist undermining my care. So I just wanted to say that, like I said, it was a very unexpected conversations there, because the goal is to make sure that you guys know that I'm helping you all put your best foot forward. Okay. So if you come to my practice, just know that that's how it is. I'm super laid back, as you can see, super laid back. My goal is just to make sure that you guys are well taken care of. All right. So before we begin tonight's episode, here is a friendly reminder. If you are in Maryland, Washington, D.C., Colorado, New Mexico, Washington State, and Utah, and you are seeking treatment, the link is in my bio. So if you are ready to reach optimal health, I am right here. I'm waiting on you. And I'm rooting for you because at the end of the day, like I said, we all deserve better care. All right. So if you're interested, please visit bit.ly/health tea with Dr. B. If you are wanting to become a patient, remember that I do specialize in PCOS, menopause, functional medicine, weight loss, and thyroid optimization. Also, if you would like to be a guest on the show to share your experiences or ask questions, please send me a message directly on Instagram, Facebook, YouTube, or send me a message directly at bit.ly/health tea with Dr. B. All right, so today we're diving into a topic that must turn into a frequent conversation because it is needed. Okay, and that topic for today is, of course, mental health. Okay, so please get ready for this tea that I am about to spill tonight. But first, let's get into this hot tea tonight because you guys know that I introduced a good tea that is great for our health. And so the tea for the week is called Exotic Soursop with Guyabano Graviola Tea. So let's see. All right, not sure if you all can even see this. Here we go. It's actually a green box. It's called Exotic Soursop Guyabano Graviola Tea. All right. So let me take a sip just real quick. So, hold on. Let's see. One more sip, another sip. Hmm, guys, okay. Not bad. Not bad. So let's figure out what soursop really is. So, soursop tea is an herbal beverage made from the leaves of a soursop tree, Annona muricata. So, the soursop tea is native to tropical regions of the Americas and the Caribbean, and it produces a large green spiky fruit known for its sweet tangy flavor. All right, now I've never had the actual soursop fruit and I've been dying to get it. I believe there is a market in New York that has it, so I have to go up there and get some. But hold on, this tea is actually not bad. No, that's not a bad tea at all. And I didn't put any sugar in it, any monk fruit, but that's actually a pretty good tea. So here are some key health benefits attributed to the soursop tea. So it is rich in antioxidants. All right, so it potentially lowers the risk of chronic diseases. It has anti-inflammatory properties, which helps to reduce inflammation. It helps to boost our immunity because it is rich in vitamin C. So it can help you fight off infections and illnesses. What I always hear is about the potential cancer fighting properties. So there are some studies that suggest that soursop may have cancer fighting properties due to its ability to inhibit the growth of cancer cells. However, more research is needed, but it doesn't hurt to give this a try. It also helps to support your digestive health, so it aids to reduce constipation and promote a healthy digestive tract due to its normal natural fiber content. It also helps to reduce stress and anxiety, which is needed because this is mental health that we're speaking about today. So, drinking soursop tea may have a calming effect, helping to reduce stress and anxiety due to its mild sedative properties. So, I would say drink this at night, because it does have a mild sedative property. The last thing I need for you all to do is drink it during the day and then you're asleep and then you might be behind the wheel. But this is the tea right here. So please definitely check it out. But here is my lovely disclaimer. The content provided in today's session is intended solely for informational purposes and should not be construed as direct medical advice. While I aim to share valuable insights and knowledge, it is important to remember that I am not your primary care doctor. The information shared does not replace professional medical advice, diagnosis, or treatment. But if you have specific health related questions or are seeking treatment based on the topics that we discussed, you are encouraged to contact myself, Dr. B, the NP, at bit.ly/health with Dr. B, or please consult with your primary care doctor for personalized medical advice. Your health and well-being are paramount, and getting advice tailored to your needs from a licensed doctor or healthcare professional is super essential, please. Now, let's sip, listen, and thrive. All right, so welcome again. Welcome again. So, this is a special episode in honor of Mental Health Awareness Month this past May. Okay, so like I said, we're diving into a topic that's both sensitive and incredibly important. And we are discussing mental health. That is typically the elephant in the room. Okay, so let's start off with some visuals. I want you all to see something. Check it out. Look familiar? Yes, that is me, the one and only Dr. B, the MP. Now, did you all pay attention to my facial expressions? Is that the look of someone who was depressed and dealing with anxiety and trying to overcome PTSD? Well, you never have to look the part. So, this should show a lot of people about the importance of checking in on your happy family members and friends. All right. A lot of those pictures were taken between the years of 2015 to 2018. So, honestly, not too long ago. I always had a smile on my face. I'm always smiling. I'm just always doing those kind of things. And I was dealing with so much trauma from being mentally, emotionally, physically abused. And I just didn't know where to turn. I mean, all I could do was smile. And everyone smiled with me. And one of those pictures was actually an engagement photo, right? Someone who was getting married, who was also just dying on the inside. Okay. So remember that it always appears that someone's puzzle is put together when really it is broken. So please check on your friends and your family. Pay attention to the signs. Okay. Because what we may think mental health is truly looks different. You don't have to look the part, and those pictures there should have shown you. All right. So let's get into the nitty gritty of mental illness. So, mental health disorders encompass a wide range of conditions that affect your mood, thinking, and behavior. And these disorders include, but are not limited to, depression, yes, anxiety disorders, bipolar disorder, schizophrenia, and OCD, also known as obsessive compulsive disorder. So, we all know that mental health disorders can significantly impair daily functioning and quality of life. So, let's get the T on the statistics. What are the prevalences? Okay. In 2021, approximately 57.8 million adults in the US were diagnosed with any mental illness, representing 22.8% of the adult population. And this rate is higher amongst females at 27.2% compared to males at 18.1%. Okay. But young adults aged 18 to 25 years of age had the highest prevalence at 33.7%. That is a lot of people. Serious mental illness also affected about 14.1 million adults in 2021, accounting for 5.5% of the US adult population. And this rate was also higher amongst females, 7%, than males, which were at 4%. Okay. Now let's try to narrow that down some when we talk about the specific conditions. Anxiety disorders affect about 99 or 19.1% of the US adult population annually. Depression is experienced by 8.3% of adults in a given year, whereas bipolar is diagnosed at 2.8% and schizophrenia affects less than 1%. So that's just now, right? But now let's keep in mind it also depends on if it is being misdiagnosed. Okay, so this is why when we are discussing different platforms who are evaluating for mental health conditions or even ADHD, it is very important to know the criteria, the rules, and what you're looking for, because some people really are misdiagnosed with ADHD or even anxiety and depression when truly it can be a mood disorder, OCD, schizophrenia. It could be a number of those things. Now let's kind of narrow in on our youth because I'm seeing a lot of youth with mental health illnesses. So approximately 16.39% of youth aged 12 to 17, that's young, experienced at least one major depressive episode in the past year. And 11.5% experienced severe major depression. All right. And the majority of the youth with major depression, they do not receive any mental health treatment. You heard that? None. And that's 59.8%. So now it's time for us to kind of put those things together. So when we think about school age children and what's going on, we always talk about how the generations just are so different, but also there's different, but then there's also lack of support, lack of awareness. So our youth are being failed. And then treatment and access. In 2021, about 47.2% of adults with any mental illness received mental health services. And amongst that treatment, it was higher with females at 51% and 40% for males. Okay. And typically, a mental health barrier or significant barrier was lack of insurance. So every time I used to see those in the ER or just sitting out to the side, or even those who are homeless, there was no insurance because we live in an insurance driven society. Okay. So, what is its impact? What is the impact of mental health? Mental health disorders are a leading cause of disability in the US. They also contribute to high rates of comorbid conditions, including heart issues, metabolic diseases like diabetes, and particularly in individuals with depression and any other serious mental health disease. Okay, now let's discuss some common and uncommon symptoms of general mental health. So take out your pen and paper. This is going to be recorded, so you'll be able to pause and go back. So, what are some common mental health symptoms? Of course, you have changes in appetite or weight, whether it's increasing or decreasing, persistent fatigue, difficulty sleeping or sleeping too much, irritability or mood swings, or trouble concentrating or making decisions. However, what is uncommon is severe paranoia and mistrust of others, persistent feelings of emptiness, sudden and intense mood changes, or extreme sensitivity to sounds, lights, or smells, or experiencing intense or unusual religious or spiritual beliefs not shared by others in the same culture. So, have you met that one person that is all of a sudden giving away their belongings? And you're like, but you like this. Why are you giving this away? Or someone who loved playing volleyball, but now they hate it, or they just have no opinion about it whatsoever. Or that person who is paranoid. You're like, hey, they're hearing voices. They think that everyone's talking about them. These are signs that I see on a daily basis. And I always look and I do a double take and I say, are you okay? Sometimes they don't know what's going on. But now that you're being educated about it, these are some signs to really look out for. Now let's go into a common symptom of depression. So you have persistent sadness or low mood, low loss of interest or low interest in activities once enjoyed, sleep disturbances. So that means hypersomnia, insomnia, fatigue, and low energy. That is the best one. But most importantly, feelings of worthlessness, excessive guilt, and thoughts of death or suicide. Please pay attention to that. Okay. Now, what about the uncommon ones that we don't really hear about? Unexplained crying, pacing or fidgeting, right? Nausea, stomach pain, headaches, back pain. Those are uncommon symptoms of depression. Okay. Now, what about anxiety? I know a lot of people who have anxiety. Shoot, I had anxiety. So here are some common symptoms: excessive worry or fear, restlessness, irritability, rapid heart rate, trembling or shaking, sweating, difficulty concentrating, right? That sounds normal, right? Hey, we see that. That's something that we see. But what about the uncommon symptoms like feeling detached from reality, feeling detached from yourself, hot flashes, chills, unexplained chronic pain? So let's think about it. You have that chronic back pain or that epigastric pain that's like right in the middle of your stomach. You're like, I don't know why that hurts. I don't know why this keeps happening to me. Or feeling a lump in your throat. These are all uncommon symptoms of anxiety. And it is something to really be mindful about. Now, let's go into the nitty gritty. These are the more specific and in depth mental health issues. Bipolar disorder. So, a common symptom: extreme mood swings, right? So, mania, increased energy, racing thoughts, rapid speech, risky behavior. So, is someone more promiscuous or spending too much money? Feelings of hopelessness and risky behaviors? That's something to be mindful about, because I know that we've all seen that one person who just all of a sudden just blew $1,000 in a day, and you know that that is not their pattern, right? That is not their pattern, but somehow this is all of a sudden happening. That is someone you need to keep a good eye on, okay? And now, uncommon symptoms of bipolar disorder: severe irritability or agitation, hypersexuality during manic episodes, psychosis. So that means hallucinations or delusions. Are they hearing things? Rapid cycling. So their moods are more frequent. Their mood swings, it's like this: bang, 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 right? It's a lot to think about. And then you have those who have mixed episodes. So they have symptoms of mania and depression simultaneously. So you're like, what the heck is going on? Right? This is all for you to kind of know what you're looking at. And now with schizophrenia, a common symptom of schizophrenia, you have lack of motivation, social withdrawal, delusions, disorganized thinking and speech, and hallucinations. So seeing or hearing things that aren't there, or flattened affect. So they're showing, or no, they're speaking with a lot of emotion, but their face isn't showing anything. That's called a flat affect, right? But an uncommon symptom is catatonia, so lack of movement or response. So the person's just sitting there, standing there like a zombie, right? Lack of awareness of their illnesses, or unusual or nonsensical speech patterns, and inappropriate or bizarre behavior. Doesn't mean that they have schizophrenia. It means that we should probably pay attention to this a little bit more. Because when I hear patients, when they come into the office or that I see them via telemedicine, they always say, yeah, they've been acting like this for about 2 months. I'm like, oh my gosh, their mental health was crying out for help for 2 months. And now they're manic, and now they've either hurt grandma or they hurt themselves, right? Right. So I didn't go over what schizophrenia, bipolar disorder, depression, or anxiety was. Okay, so you can always feel free to look those up. I just went through their common and uncommon symptoms. Now let's get into the real tea. Mental health conditions can be influenced by a variety of risk factors. So risk factors, that's the T. Risk factors, which can be biological, psychological, environmental, or a combination of these. So let's go with the biologics, right? We have your genetics. A family history of mental health disorders increases the risk of developing similar conditions. So have we met people who said, hey, grandma had it, my aunt had it, my mom had it, my sister had it, now the kids have it? Genetics. Neurochemical imbalances. So, like serotonin, dopamine, and norepinephrine, those imbalances can throw someone off. Even chronic medical conditions. So, conditions like diabetes, heart disease, chronic pain, that can increase the risk of depression and anxiety. Imagine just always waking up in pain. How would you feel? How would you feel if you're bedbound, right? You will always feel trapped. So, of course, yes, of course, that will be a much bigger issue. You will have depression or anxiety. Okay. And now, psychological factors, we have trauma and stress. So, trauma like physical or emotional abuse can significantly increase the risk of mental health conditions. So, remember earlier when we were looking at my pictures and I said, hey, I was someone who was physically, mentally, emotionally abused, spiritually abused. This is what caused me to go through a depression and have anxiety. Personality traits, right? There are certain personality traits that can predispose individuals to mental health issues like neuroticism, right? Neuroticism. That's Neuroticism. Okay. Then we have environmental factors. So you have your socioeconomic status. So stressors like unemployment or financial instability can increase that risk. Social isolation. So, lack of social support and feelings of loneliness are strong risk factors for depression and anxiety. So, this is why I always say check on your family members and friends because although we know or we feel that they're not alone, it depends on basically how they feel. We can't put that in their head. I can't say that, hey, you shouldn't feel like this because I'm always there. It's how they interpret it. Okay. So mental health is all about interpretation and how one feels personally. How is their mental garden? It's not about what we think their mental garden should look like. Okay. And now, what is another risk factor? Drug use. So, the use of drugs and alcohol can significantly impact mental health. And these drugs, like marijuana, cocaine, methamphetamines, opioids, they are strongly associated with the development of mental health disorders like depression, anxiety, and psychosis. And typically, we see a higher rate of mental illness amongst African American males who have experienced drug use with marijuana, PCP, fentanyl. So, a lot of them have mental health illnesses that are brought out of the dark due to those drugs. Okay, can't really be explained because typically we say, hey, it's just lying dormant, and that substance abuse is what drives it out. So I want to show you all a video of my cousin Tavares, um, and I'll tell you his story momentarily, but watch this video here of my cousin's life.
A second can be used to form a deadly weapon. Through these speech, verbal scriptures, and early lectures. A chapter added on to make the life better. Daddy, 12th disciple in the holy sector. Infinity above beyond universal residence. They see the depth of the straight, a buried treasure. Simply, crushed with his mighty arms. A weapon enemies like Pharaoh in the book of Psalms. I roamed the earth, John the Conqueror was fully mine. The last supper Satan had. Took the devil wine. On judgment day, let's see who go. Let's see who say. Who tell the truth, who tell a lie. Let's see who say. They actually been to hell and back like my family has. Control the souls of present time, future and what? The chances. One might strong like the sun, no. The earth is set to empty shine and it's falling on.
All right, guys, that was my cousin Tavares. He is no longer with us. I wanted to share his story because he passed at the age of 37. But he had a nice struggle. Grew up just fine. He's a cousin of mine. Grew up just fine in New York, right? And he was a star. His passion was music. His group finally made it and they were signed. And he got married. And while in California, someone who was very close to him offered him marijuana, but they laced it with angel dust. And that was that. He had always acted normally. There were never any signs that, now that we discussed the common and uncommon signs, there were never any signs. He was always happy. He was just blooming like a blooming flower, right? And he had this marijuana that was laced with angel dust. And shortly after, he went into a psychotic break. It had to be admitted. They found him running down the street naked. And although it was never disclosed, he was pushed into schizophrenia. Had he always had schizophrenia? Maybe. Was it just underlying? Was it lying dormant? Was it hiding? Yeah, I think so. But all we know is that he was poisoned by angel dust. And he wasn't a smoker. It's the funny part. He wasn't a smoker, but he was poisoned with angel dust. And that was the day that we lost our cousin. He didn't die immediately from that. He lived with the schizophrenia, but it was never the same. His thought process were never the same. He always had delusions, always had hallucinations. We never knew what was true or what was, we just never knew. We never knew what was going on with my cousin after that. And I share that video with you all because it is very important to see how our loved ones used to be, and drugs being used as a catalyst for underlying mental health conditions. So his were brought out. His were brought out. Okay. And not to mention, when we talk about cultural factors, there's so many cultural attitudes towards masculinity in mental health that can discourage African American males from acknowledging and addressing their mental health needs, right? So it's such a complex issue because at the end of the day, with my cousin, he spent a few years with the schizophrenia, but he was unable to, he lacked awareness of his own physical health. So ultimately, my cousin passed from undiagnosed testicular cancer, one of the most curable cancers, right? And he just didn't know. It wasn't even the mental health piece that, unfortunately was the reason why he's not here. But all I can say that was probably a risk factor for him not really understanding because he was so out of touch with reality. So a lot of mental health and drug use affects us very, very closely. So there's a lot that's going on into somebody's world. We just have to really dig into it. Okay. So thank you all for, watching the video. That makes me happy because that is my cousin. Rest in peace, Tavares. All right. So now we're going to move on to conditions that shed light on mental health because some may be missed. So vitamin D deficiency. I got to get my tea for this one. Here is the tea. You have to beg your doctor just to check your vitamin D. You have to beg them. You have to almost be crawling on your knees to to beg them to check your vitamin D levels. So vitamin D and depression. Vitamin D is often called the sunshine vitamin, and it is sometimes referred to as the depression vitamin because low levels of vitamin D are strongly linked to depression. So this vitamin helps to regulate your mood, and deficiency can lead to feelings of sadness and hopelessness. You hear that? This vitamin helps to regulate mood. So when it's low, you will feel sad and feel like you're hopeless. So when I hear people say, they come to my office, oh, I do a vitamin D depression or vitamin D deficiency all the time, I'm like, well, fix it. Right? I'm like, fix it. Because that can be fixed with food and supplements, right? Now, here's the tea on thyroid disorders. Many thyroid disorders are missed because thyroid disorders are not thoroughly checked into. When you go to the doctor, what do? They check your TSH and that's it. Hey, you're fine, right? But let's get into this tea. Hypothyroidism and depression, that's when your thyroid is underactive. It can lead to symptoms like fatigue and weight gain and depression. And that is because low thyroid hormone levels can slow down your bodily functions and negatively impact your brain function, leading to mood changes and depressive symptoms. That is hypothyroidism. And now, what about hyperthyroidism? So, conversely, an overactive thyroid can cause anxiety, restlessness, and irritability due to an excess of thyroid hormones, speeding up your body's processes. So it's just going just like this, right? Okay. So we talked about vitamin D, hypothyroidism, hyperthyroidism. Now let's discuss hormonal imbalances. So this is more hot tea. Did you know that hormonal imbalances can mimic health issues? Okay. So menopause, we discussed this a few weeks ago, mood swings and depression. So during menopause, levels of estrogen and progesterone in a woman's body fluctuate and eventually decline. This means that our women are going to have mood swings, depression, and anxiety and feel sad. And then sleep disorders or disturbances, perimenopause and menopause will cause sleep issues, which will then further contribute to mood issues. So you see how all of that relates? It's a lot. So we talked about menopause. What about andropause? What is the T on that? What in the heck is andropause? That is testosterone deficiency, often referred to as the male menopause. Yes, men can go through menopause. So it involves a gradual decline in testosterone levels in men, and low testosterone can lead to mood swings, irritability, and depression. So men with low testosterone levels often report feeling less motivated and more fatigued. All right. Testosterone also affects cognitive functions, and a deficiency can lead to problems with concentration and memory, exacerbating feelings of depression. So these are things that we have to look into. This is why when a lot of my men come to me for our TRT program, when they get started on testosterone, they're able to sleep, they don't feel hopeless, and they get more energy. And what about my favorite population, my PCOSers? Polycystic ovarian syndrome. PCOS is a hormonal disorder common in women of reproductive age, and it's characterized by irregular menstrual cycles, excess androgen levels, and sometimes polycystic ovaries. But I always teach that you do not have to have cysts on your ovaries to have PCOS. So women with PCOS often experience mood swings, anxiety, and depression. Then we have insulin resistance because PCOS is frequently associated with insulin resistance, which can lead to weight gain and then further impact mental health. Okay, so those hormonal imbalances and metabolic issues can create a cycle of physical and emotional distress. And that is just to name a few. So here are some labs to consider. And now, what's the T with that? Finding a provider who is willing to do the deep dive and go into your labs. Vitamin D is important. What is an optimal level between 60 to 100? Right? Vitamin D. Thyroid levels. This includes TSH, free T4, free T3, and sometimes your thyroid antibodies, because these tests can detect conditions like hypothyroidism, hyperthyroidism, Graves' disease, and Hashimoto's. Okay? When you figure out what the issue is with that, we can now alleviate related symptoms like depression, anxiety, and fatigue. Your iron and ferritin. Why are they important? Iron is crucial for carrying oxygen into the blood and supporting brain function. So, low levels of iron can lead to anemia, causing symptoms like fatigue, depression, and cognitive difficulties. So, we need to check our iron. I can probably ask a question and say, who here has had their iron and TIBC and ferritin levels checked? See, not a lot. But once you know better, you do better. So try to have your doctor check for these things. Check your hormones. We need to figure out your estrogen, progesterone, testosterone, cortisol, and your melatonin. We need those levels. So there's so many different ways. We could definitely check it through blood, or we can check it through urine with the Dutch test. And Understanding hormones help us with diagnosing conditions like perimenopause, menopause, andropause, PCOS, and adrenal fatigue. So I know in our last podcast we discussed what the Dutch test was and why I offer it. Remember that you can always follow me or look up bit.ly/health tea with Dr. B for more information regarding the Dutch test. Okay. But now let's get into the mood with supplements that help with mental health conditions. So we have good old ashwagandha, which is an adaptogenic herb traditionally used in Ayurvedic medicine. So what does ashwagandha do? It helps to release your stress and anxiety. It helps to lower your cortisol levels. Okay. Helps to improve your mood. And typically, I see 300 to 500 milligrams of ashwagandha given twice daily. Anxiety, that is one of them, ANXIE-T by Life Seasons. It is a dietary supplement blend that is designed to reduce anxiety and promote relaxation. That is one of the great benefits of anxiety. You typically take 1 to 2 capsules daily. Also, with GABA, which is a neurotransmitter that inhibits the nerve transmission in the brain, calming nervous activity. Okay? Yeah, helps you sleep too. So take that at night. It's commonly recommended to take 250 to 750 milligrams before bedtime. We also have NAC, also known as N-acetylcysteine, which is a form of amino acid, and it helps produce glutathione, which is a powerful antioxidant. Okay, and this antioxidant supports brain health by reducing oxidative stress and inflammation, which can benefit mental health conditions like depression and bipolar, right? So we usually take 600 to 1200 milligrams per day, along with NAD, right? Who's heard of NAD? Nicotinamide adenine dinucleotide. It is a coenzyme found in all living cells and is essential for energy production and cellular health. So, NAD plays a crucial role in mitochondrial function and energy production in the brain cells. So, it helps to improve cognition and mental clarity. So, those who come into my office to get a NAD shot, oh, they almost experience it immediately. It helps to improve your mood, all while reducing symptoms of depression. Usually, I if it's intramuscular, it can be given up to 3 times per week. Okay, but don't forget that there are also lifestyle changes for mental health, like physical activity, right? Because exercise boosts the production of endorphins, which are natural mood lifters. So aim for at least 30 minutes of exercise daily or most days of the week. Having a healthy diet, so foods that are high in omega 3s like fish, walnuts, flax seeds. Reduce the intake of processed foods, sugars, and excessive caffeine. Getting adequate sleep, that's 7 to 9 hours of quality sleep per night. Stress management. We all hate therapy for some reason, but it's so needed. If you can't afford it, practice mindfulness, meditation, deep breathing exercises, or progressive muscle relaxation. So engage in hobbies and activities that you enjoy. Most importantly, having a strong social support system can help provide a buffer against stress. So spend time with family and friends and join clubs or groups with similar interests or consider volunteering. Avoid substance abuse, especially in this day and age. In this day and age, we can't trust what kind of drugs we're taking, because they can be laced with a lot of things. Professional help. Consider seeking a mental health professional such as a psychologist, psychiatrist, or counselor. Do not hesitate to reach out for help when needed. Please don't. Please don't. And so today's session was to help you get a better understanding of mental health conditions that can help you provide better support for yourself and for someone else. So provide a listening ear, right? Educate yourself, promote healthy lifestyle choices, and most importantly, be patient and compassionate. Avoid making assumptions, be a good listener, and reassure them that you are there for them. That is sometimes what all a person needs to hear, right? Encourage social interaction, inviting people to social activities, or helping them keep track of medications and attending therapy sessions and celebrating small victories in their progress. Sometimes what is needed is just support and actually being there for that person who needs you. So that is super, super important. I thank you all for really being here today. Thank you for tuning into this episode of Sunshine and Serenity, Nurturing Your Mental Garden. I hope today's discussion has shed light on your mental garden, helping you to identify the weeds that may be hindering your growth and offering tools to overcome them. So remember, just like a garden needs sunshine, water, and care to thrive, so does our mental health. So, by understanding and addressing factors such as vitamin D deficiency, thyroid disorders, hormonal imbalances, we can create a more healthier, vibrant mental landscape. We covered how low vitamin D levels, often referred to as the depression vitamin, can lead to your feelings of sadness and hopelessness, and how obtaining proper levels can brighten your mood. We also discussed the importance of thyroid tests and uncovering hidden issues that may be affecting your energy and mood. Additionally, we touched on how iron and ferritin levels are crucial for maintaining cognitive function and emotional stability. Okay. We discussed different supplements that would offer significant benefits for mental health by reducing stress, anxiety, and depression. All right. And just different lifestyle changes and how you can help. I hope this episode has inspired you to take proactive steps in nurturing your mental garden. All right. Remember, identifying and addressing the root causes of your mental health issues is a journey, but with the right knowledge and tools, it's the one that leads to growth and serenity. So, thank you all for joining me today. If you found this episode to be helpful, please share it with others who might benefit. And again, don't forget to subscribe and tune into our next episode for more insights and tips on maintaining overall wellness. So, until then, keep shining and nurturing your mental garden. All right. Please do not forget to follow Health Tea with Dr. B on Facebook, Instagram, and YouTube. Thank you all for your support. You guys are always great. Thank you all for always attending my podcast and my episodes. If you are interested in learning more information, please visit bit.ly/health tea with Dr. B. Okay. All right, guys. Until next time, I will see you all later.